Well, good afternoon, everybody, and welcome back to the 2021 Peggy Lillis Foundation C. Diff Advocacy Summit. I am the Executive Director of Peggy Lillis Foundation and co-founder with my brother Liam. And we have two exceptional panel discussions for you this afternoon. The first is about enhancing enhancing C. diff patients' interactions with healthcare workers. And then after that, we're going to have a really great panel on the unmet treatment need for people with recurrent C. diff infections. So stick with us. As always, if you have questions, you can post them in the chat. But I'm going to be introducing and turning this over to a video from one of our advocates, Lauren Levy, who is not able to be with us at the summit this year, but who recorded this in advance. And when we come back, my friend and board member of the Peggy Lillis Foundation, Christina Furman, will be introducing our panel. So thanks for being with us, and we hope you enjoy the afternoon programming.
Hi, my name is Lauren, and I'm from South Orange, New Jersey, and I am a survivor of 2 rounds of C. diff caused by antibiotics. It was really very difficult for my family. He had to put the kids first, and I was in the hospital by myself, and there were times when he couldn't visit me because he couldn't leave them alone. So it was really, really very, very hard. Not only do I suffer from the physical symptoms of C. diff permanently, I do suffer the mental. I do have PTSD, when I haven't gone to the bathroom in a week or something like that. And I think what's going on with my body? And, this is because of the C. diff. I'm not regular anymore. And then I'll reach out to somebody in the foundation who's had post-infectious IBS, who went from, going to the bathroom all the time, who stopped going to the bathroom. And I'll say, did you experience this? Did you go through this? So it's really given me a community of support and guidance. The Peggy Lillis Foundation gave me a lot of hope. It gave me a lot of information. It gave me a place to feel comfortable. It gave me the sounding board, talking to other people. Christian has been amazing, so knowledgeable. I really like that the foundation is it's a community.
Good afternoon, everyone. My name is Christina Furman, and I serve as a member on the PLF Board of Directors, as well as co-chair our wonderful Advocates Council. I'm glad that everybody could join us today. I'm very pleased to introduce our new panel called Enhancing C. diff Patient and Family Member Interactions with Healthcare Workers. All too often at the foundation, we hear from patients who are feeling very frustrated. They feel neither seen nor heard by the healthcare system, myself included when I battled C. diff for 7 months. At the same time, we also work with incredible doctors, nurses, and other healthcare professionals who are doing their very best to treat patients in a broken system. The divide between patient and healthcare providers can be very strong. And at many times, we find that we are frustrated and angry with each other, even when the healthcare we are receiving is very good. It takes a lot of courage for both the patients and the providers to talk across this divide. That's why I'm so proud of our next presenters, including my fellow board member, Dr. Bruce Hirsch, Teri Hewlett, who is a nurse and also a member of the Advocates Council, and 3 of our very brave and tenacious advocates, Carol Ray, Ricky Spees, and Maryann Webb. I thank you all so much for joining us and talking about this important issue.
Thank you, Christina. My name is Bruce Hirsch. I'm an infectious disease doctor. And I work with patients who have C. diff. And the unfortunate truth is that working with doctors is challenging. Working with our healthcare system is difficult, and too frequently it's traumatic. I want to hear our stories. I want the survivors, the advocates, to discuss what their experience was like having C. diff and interacting with a healthcare system that sometimes is distracted, focused on other things, and not ready to listen. For this hour, this is our chance to truly and generously listen to each other and to hear what the issues are and to see if together we can come up with a way of doing things in a better way, in a way that's more meaningful. So we have some stories to listen to today. Um, Maryann will speak first, then Carol, then Ricky. Teri will discuss her perspective as a nurse. Finally, my perspective as a doctor and some of the frustrations that I deal with. And I've asked everyone to keep their stories kind of brief, about 5 minutes each, because we want to respond to each other's stories and we want to hear from you. We want your responses. We want your questions. We want your perspectives in terms of what it is that we're dealing with now and how we can make it better. So up first, Maryann, what has been your experience with C. diff and the healthcare system?
Thank you, Dr. Hirsch. I experienced 3 years of a recurrent C. diff infection, and when I was first diagnosed, I didn't know what it was, and nor did the doctors know what it was. I probably had C. diff for a good 2.5 months before I had a test that was not false negative but came back positive. So during that time, I had already begun to have this frustrating feeling with the healthcare system because my body was completely rejecting me, rejecting the planet, rejecting food, and there was absolutely no reason for it that the medical community could come up with. And it began that began my journey, and I can tell you after the first 3 hospitalizations is when I was finally diagnosed, and I had a doctor come into my room early in the morning. And now C. diff, of course, it's different for many people, but for me, it presented with uncontrollable diarrhea, to the point where it was explosive. There wasn't anything I could keep in my body. I was vomiting and having diarrhea. I counted one time more than 20 times in an hour. So you can imagine what that was like, from both ends of your body. This is not just a simple diarrhea event. And I had a doctor come into my room, and he said to me, quite frankly, "Do you think that having diarrhea is a reason for you to be in the hospital?" And that just took me back, and I thought, well, I mean, if not me, then who? I mean, I couldn't. There was literally nothing I could do. I couldn't lift my head off of a pillow. They couldn't even get IVs into me. They had started to put IVs into my legs, and then they would put these boots on my legs in order to keep the circulation going. But I was a patient who had explosive diarrhea, so all semblance of modesty went out the window, and I was alone. My husband was working all the time. My daughter was in school. I didn't want them to get sick, and I didn't have any family support because no one really knew what it was that I was dealing with. And the longer this went on, the weaker I became. I was given a lot of different. I was given vancomycin, Flagyl, Difficid. I had a PIC line. I had total patient nutrition through those lines. I couldn't eat. I was usually on nothing by mouth. And then, of course, I was isolated in the hospital because of the infectious nature of the disease. So for years, it felt like the only human touch I ever felt was through a purple latex glove. And basically, I think that I would like for the healthcare workers, the doctors, I felt like they didn't listen to what I was feeling. Every time I had a recurrence, I went back to the same hospital. They had my records. I told them it was back, and they didn't listen. They said, "Well, it could be IBS. It could be that." I said, "No, I know it's back. I actually know it never left. I know what it feels like. It's different to anything that any of us have ever experienced. And once you've had it, you know what it feels like." So there shouldn't have been any question. And yet I constantly felt like no one was listening to me. And in addition to that, when you're very sick, you can't advocate for yourself. So I was experiencing a lot of other not physical side effects, although I believe they had a root cause with the toxins of the C. diff bacteria. And that was mentally. I had this brain fog that many people have heard of now with COVID. And I completely understand what that feels like, where you just can't focus on anything. I couldn't read anything. I couldn't remember a lot of things. I didn't know if it was the disease or the medications, but you're basically left in a hospital with healthcare workers who really don't understand the great toll that it's taking on you and your life. You lose everything. You start to lose relationships, you lose jobs, you lose financial security, and finally, you lose your life.
Maryann, thank you for the courage and telling us the story so beautifully. The loss of everything, the way this experience took away dignity, control, your connections with family and friends. It's, as a human being, to hear you go through that story is upsetting, and I really appreciate the fact that your narrative is something that we can point to and understand. Um, Carol, what was your experience like?
Well, first of all, I want to thank you all for inviting me today. I broke my wrist, severed a bone in my wrist in an extreme gardening accident in 2010, and had wrist surgery in early 2011, which is probably where I picked up C. diff. A few years later, I had a seasonal job where I was laid off between Thanksgiving and New Year's Eve or New Year's Day. And on the 4th of December, I went to the dentist and was prescribed clindamycin. And I did not know what was happening to me. I was living alone at the time. I was so sick, I couldn't even comprehend what was going on. And on the 28th of December, thankfully, my boss called me and asked me to come in and close out the bookkeeping for the end of the year. And I told her I couldn't get out of bed and that I was so sick, I didn't know what to do. And she scooped me up and took me to the doctor and saved my life in many ways, because I think I would have just faded away. So I went through 2 rounds of metronidazole and multiple rounds of vancomycin, and was very sick and alone. Nobody would come in my house because it's so extremely infectious. But I did have 2 friends that would leave me groceries on the front step and ring the doorbell. I could barely get off the couch or the bed to even cook for myself or clean for myself. And weirdly enough, my ironically named cat, Stinker, somehow became my service cat, and she would jump on my belly in the middle of the night right before I was going to have a diarrhea attack. And she did this repeatedly, so it was very interesting. My doctor at one point, my beloved doctor of a decade, turned to me and he said, "I can't do anything for you anymore. I don't know what to do. I don't know who to call or where to send you. And I mentioned to him that one of my old guitar players from a band I was in was a teaching physician at the residency clinic in our state. And he said, oh, if you can see Dr. Palmer, go see Dr. Palmer. Well, that's when my luck changed, because Dr. Palmer loves me dearly, and he shepherded me through the system. He slipped me in to the HIV clinic to see an infectious disease doctor who prescribed compounding pharmacy to take liquid vancomycin and put it into a syrup that I could at least take the drug and it wouldn't be so expensive. And he got me through the system. We have in our state a volunteer physicians network. He found a gastroenterologist who would do a fecal microbiota transplant for free. He found a hospital who would donate the procedure room. The only thing I was charged for was the anesthesiologist. And that saved my life. And a funny story, because I was so thin and so weak, I could barely get in the car to go to the hospital for the FMT. First words out of my mouth in recovery were, I think I need some French fries. And the nurse just laughed and said, you go get those French fries, honey. So because of my good fortune of knowing a doctor who loved me and was going to go to the end of the earth for me, I have become an advocate to promote shepherding through the system to doctors and hospitals. And I have been working for many years on the Patient Advisory Council for the Residency Clinic Board of Directors. And I'm very, very lucky. I have long-term colitis, so I do still suffer, but I didn't die.
Carol, thank you so much. The good fortune that you had should not be the requirement of a healthcare system. You should not have to be in a band with a beautiful doctor as a fellow bandmate, as an insurance policy in case you develop medical problems. Our healthcare system is so hit and miss. And I think that your advocacy work with the residency program is invaluable. And thank you so much for sharing that story. Ricky, what was your experience with C. diff?
So thinking back in 2008, my grandmother was in the hospital. She slipped and fell, and I would go and see her every single week. I would go into the room, hug her, kiss her. She was my grandmother. I loved her very much. She eventually died in October, and it was terrible, but I had never heard of C. diff at this point. Fast forward about a year and a half later, I was having the worst stomach cramps and the worst symptoms. So I went in to see my general practitioner, and right off the bat, they said, oh, you're 23 years old. This was 10 years ago. And they said, take fiber at bedtime. You just, that'll kick it. Don't worry. I've been doing this for years. And I said, well, okay. So I took fiber at bedtime. A week and a half later, there I was again, minus 5-6 pounds from where I was before. And I said, fiber didn't work. What is this? And to be honest, it's actually hard to say. I've never said this actually out loud. The doctor said, well, when was your last HIV test? And, she was obviously referring to the fact that I was openly gay. And she asked me that, and she said, yeah, we need to get you tested for HIV. And I said, I'm pretty sure it's not HIV. I'm in a committed relationship, but okay, thank you for putting me in another box. And long story short, I did have a stool test done, and it came back positive for a parasite. I think it was Blastocystis hominis is one of the names of it, but C. diff wasn't there. So they treated me with Flagyl. I was on Flagyl for the course, and I felt great afterwards, but then it came back even stronger. And they said, let's go ahead and have another stool sample. This time it came back positive for Clostridium difficile, for C. diff. So right off the bat, being the millennial that I am, I went into research mode, Googled everything, and started to educate myself. Fast forward from here, I went to see a gastroenterologist who, once I'd been on Flagyl for multiple times, they switched me to vancomycin. And I was on vancomycin repeatedly for about 6 months before I raised my hand and said, what about a fecal transplant? I'm seeing a lot of talk about this. And she said, well, there's a lot of red tape around that. I'm not sure I can do it for you, but let me see what I can do. Was on hold for a long time. And when I say on hold, I went home and just continued to take Vanco. And at one point I was up for a refill for my Vanco. I wouldn't leave home without it. I had those pills with me everywhere because they're the only thing that seemed to contain my symptoms. My doctor was on vacation, so I had to get another doctor to take a look and approve the prescription refill. And the doctor said, what are you doing on Vanco? Like, what's your plan? I said, I don't know. You're the doctor. You tell me. So that's when they tried the pulse dose and the taper, but that's when I finally said enough is enough. And I told my doctor, I said, are you going to do this FMT or not? And she said, the hospital will not let me do it. I cannot do it. So I said, fine. I did the research and I ended up doing the FMT myself at home on my bathroom floor. Now, my doctor was supportive in this, but she did have me sign something saying that, she was not responsible if anything went wrong. And this is 10 years ago, granted. So it's memory fog, like has been mentioned on this. It was traumatizing to have to do this myself, but I was at a point where I had no choice. Like I said, I was 23, 24 years old. And something that the doctors kept telling me is, well, you're so young, like you're healthy. Besides this, you don't smoke, you don't, do drugs, you drink, sure. But, this doesn't quite make sense. That's when my mom kind of went back through our emails and found out that my grandmother had C. diff. And I had never known about this. Yet I went to visit her hugging her, kissing her, obviously washing my hands. But my grandmother was a sick woman in bed with C. diff, and I had no idea. And that was strike one for me. I was like, no one ever told me. And doing my research, there's people that won't even go into these rooms without, completely gowning up and, sterilizing everything. I had no idea about that. So that it's just kind of a testament that, not people really didn't. And when I say people, I mean the physicians didn't really quite understand where I was coming from and how frantic I was. But yeah, that was my experience with that right off the bat. And granted, it's been 10 years this month since I had my last positive result. And, just like the others have said, there's definite PTSD, especially in the pandemic, where you have to wear a mask and you're careful around other people. So in a nutshell, that in 5 minutes or less, that's how I experienced that.
Thanks so much, Ricky. I'm so impressed with your initiative and your focus and your follow through, and doing that fecal transplant is just kind of an amazing story. Teri, what is your experience around C. diff, around C. diff patients, and what is your perspective in terms of hearing some of the stories we've heard this afternoon?
Yeah, so I'm going to echo everything that Dr. Hirsch has said in terms of just being impressed with all of your stories, and also realizing that in healthcare, we really do need advocates for the patients and for the staff. My background is nursing, neonatal intensive care nursing. And so as a neonatal nurse, we learned really quick that we were the voices for those neonates. We became their advocates to make sure that everything we did in that unit protected them from harm. When I went into infection prevention, with a mind frame that we're working with adults for the most part, and I didn't realize the need for advocacy for those patients until I started getting out on the units and realizing what education gaps there were, and specific to C. diff. And each of our presenters, Maryann, Carol, and Ricky, have addressed the gaps in education, not just for patients, but for nursing staff as well, and for providers, to talk about antibiotic stewardship and how that drives increased C. diff, to talk about the importance of compliance with contact precautions and why we do contact precautions. And Ricky's a perfect example of making sure that people that are going to visit a patient in a contact precaution room, whether it's C. diff or something else, they have to follow the same rules in terms of gowning and hand hygiene, and making sure that all those pieces are in place so that we're not sharing within the hospital, or that someone that comes to visit isn't taking it out of the hospital and then exposing other people. And until I had a friend whose husband contracted C. diff, was in the hospital that I was an infection preventionist in, and realized that she had no clue about C. diff. Antibiotics had been prescribed inappropriately. And then everything that could have been done wrong for him was done wrong, from giving antidiarrheal medications to just not understanding why C. diff should have been checked and the importance behind it. He ended up passing away, and that was kind of what drove me to the Peggy Lillis Foundation, realizing that there is a huge need for education, both in the healthcare setting and outside of the healthcare setting. So that's kind of my experience, is just really realizing the gaps in education, realizing that we who are educated need to advocate. Carol was talking about how she didn't have anybody there for her, Maryann, when she was in the hospital and her husband was working and stuff. We, as the healthcare providers, need to educate, and we need to advocate. One of the things that I did when I was still in the hospital setting was make sure that if I had people that I was following with C. diff, I would make sure that they knew I was there to answer questions. I would meet with their families. We would talk about what C. diff was, the antibiotics they were on, the course that they could expect, and then what to expect once they got out of the hospital. I tried to help educate them on what questions to ask, and that they could expect us as the healthcare workers to take time to explain those questions and answers. And so that's kind of my story in a nutshell. I think it's important that we start educating, not just in healthcare, not in just hospitals, but outside. Dentists, podiatrists, whoever's prescribing antibiotics.
Thank you so much, Teri, and thank you for the education and the advocacy work that you do. I'm hearing these stories, and I'm reflecting on my own experience as a doctor, working as an infectious disease physician in my office and in my clinic, and I'm feeling a sense of grief. I'm feeling a sense of pain, of mourning, of the fact that this is not the way it's supposed to be. Some of the themes that we've heard: the loss of control, the loss of dignity, the diagnostic uncertainty, doctors who don't know. These are painful issues for me to hear as a doctor. These are painful issues for me to experience as a doctor. There are times that I don't know. There are times that I don't have control of my own schedule. There are times that we're all under different pressure. And it seems to me that being able to identify the fact that our healthcare system is flawed, and thank goodness we have individuals like Teri who go over and beyond to educate, to be present for other people, that we have physicians among us like Dr. Palmer, who is the guitar playing, loving physician that really made a difference in terms of Carol's life and Carol's experience. There are angels among us, and we need to recognize them, we need to support them, and we need to be as kind and as understanding as possible to each other in order to be able to face this. So I'm interested in other comments and other reactions. I'd love to hear from Maryann, from Ricky, from Carol, Teri, about what they think in terms of what we are all describing and we're all encountering, and also looking forward, what are the positive changes that we can make to make things better? what are the aspects in your stories that made a positive difference moving forward? So let me stop here and see if there's any comments.
I'm going to pop in. I did a presentation before the Patient Advisory Council at the residency clinic for C. diff Awareness Month, and that was in November of 2019, or maybe 18, I'm not sure. But what I wanted to impress upon them was that they need to teach the residents that the hand sanitizer is not going to kill C. diff, and that they need to be advocates for their patients. And hand washing was my big message. And so the CEO of the residency clinic mentioned to me one day, hey, we did a video on hand washing, and now it's going to play on the TVs in all the lobbies. Well, that happened right before COVID. So it couldn't have been a better time for them to post that. But I just was so grateful that I was heard and that they did something to get the message out to all the patients.
That's beautiful.
Teri, I'm really impressed that you took it upon yourself to do a lot of the educating with your patients and follow-ups with your patients and also with their families. I know that I definitely would have benefited from medical professionals explaining to my family, since I really wasn't able to do that, what was going on and as you mentioned, what I could expect. I think there was an expectation that when you leave the hospital, you're better. But that's not at all what happened to me. And also, there are so many other side effects and difficulties with C. diff that our families and our caretakers, if you have them, if you're lucky enough to have them, just need to be aware of. I mean, there was a point at which I had lost so much weight, I couldn't remember things, that, I was accused of needing to be in rehab, not in a hospital with C. diff infection, because people just didn't understand I was fading away and it must be something else. So it's really, really important that people communicate to the patient and to the family. So I appreciate you doing that, Teri. That's huge.
Thank you. I think it's also important that we educate the bedside providers, from nurses to the environmental services staff. There's a whole bunch of stuff that need to be in place, from appropriate antibiotic prescribing to appropriate testing to appropriate cleaning, helping EVS understand how and why they need to clean, what they need to use. And if we as the experts aren't there to provide that education, whether it's to a patient, to a nurse, or to a housekeeper, they don't know. And I think that was kind of my big aha moment, was we make a lot of assumptions that it's been around for a while, people know what to do, but in the reality of things, there's so much turnover and there's so much change in healthcare that not everybody is educated the way that they need to be. So.
One of the lessons that I'm very impressed with is that working in the hospital, that the illness is not completed at discharge. A long time ago, I participated in a study of pneumonia, and I'm an infectious disease doctor. I give antibiotics. We give antibiotics for a period of time, and the bacteria is gone, and the person is able to leave the hospital. But when we did follow-up interviews, there was a substantial number of people who weren't back to their baseline 2 months after that hospitalization. Having an infection, having an event in the body is a profound experience. And people are not, even when cured from their infection, whatever that means, there is a recovery process that continues after it. The C. diff is a toxic colitis. And some of the effects that we're hearing about in terms of malnutrition, of brain fog, of weight loss, of debility, in addition to the psychological trauma, is something that continues over time. And that to me is something that I've been educated about, working with people in the hospital and also in the clinic.
I agree. It's a long-term thing. It's not like a cut that you get treated and that cut heals and everything's done. Yeah.
I'd love to jump in on that because you said a lot of things that sort of, triggered memories in my mind that, yeah, psychologically, I don't think I will ever be the same. I'll ever be fully comfortable going into a hospital. But at the same time, Teri, I know you had mentioned about educating, dentists or other types of people who prescribe medication. I went to the optometrist for an eye infection, which that's how I initially got C. diff, was Cipro via eye drops. And I was told, oh, it's not possible. You can't catch C. diff, through Cipro via the eye. And I said, well, where's your study on that? And, let me just get on my soapbox really quickly and tell you what I've read and who I've talked to all over the world. So I think I 100% agree with you that education needs to be, out there a little bit more. And, not necessarily like going down the checklist that I felt like they did with me. And pretty much, yeah, like it's really not a glamorous disease, and there's no other way around it. I had my FMT and I still showed symptoms. I still show them until this day, and it's been 10 years. And will that ever go away? No, but I did have a doctor in my experience though that, I came in and she said, how are you doing? And I said, oh, well, I've got, a little bit of stomach pain. She goes, no, how are you? And I burst into tears because I think she was maybe the 5th or 6th physician I'd seen. And that was the first time someone had actually asked me how I am doing. So.
And that's where we need to get to. We need to get people to understand that it's not just a symptom. It's not just the diarrhea. It's the overall picture. I had a situation with my husband, being a dentist, and he would go in for teeth cleaning every 6 months. He'd get it done. And finally, I don't know, a couple of years ago, he shared that they've been giving him antibiotics before he gets his teeth cleaned. And so we had this in-depth discussion about, you don't need to take it. There's no reason for it. And I kind of stood my ground with him to the point that I went in with him for his next teeth cleaning with information in hand, and had a discussion with his dentist who said, nope, we're doing it or we won't clean his teeth. And I finally had to stand my ground and say, number one, you're not following your professional organization's guidelines, and I had him with me. But I also had to go to the extent of telling him that I will find care for my husband elsewhere where they will follow those professional guidelines, if that's what I have to do. And he finally gave in, but he turfed it to the dental hygienist. He says, well, if she'll do it without him getting the antibiotics. And I said, no, she works under you. She works under your license. You have to take control and follow your professional organization's guidelines. And so for me, that's where I like to educate people. What your resources are, where you can find the information to advocate for yourself, because not everybody has a need. And when we left the dentist's office, that's what my husband said. We were driving home, and he said, Teri, he says, I'm fortunate to have you to stand up on my behalf. He says, but I realize now that not everybody has that voice. And so that just helps me move forward in trying to provide that knowledge and that education, and teaching people how they can advocate for themselves when they don't have somebody to
I like the fact that we're acknowledging that healthcare workers are far from perfect and not a complete authority, and that a lot of us doctors do things out of pattern. The American Dental Association guidelines are clear that antibiotics are not needed in all kinds of circumstances that are that used to be the standard of community practice. And to be able to access the literature the way Ricky has done, the way you had the initiative and the strength of purpose to be able to do that, and to ask questions and to really delve into what's the reason for these different things, I think is important. We have a number of different comments in our chat session. One comment from Amanda is, "It's amazing how it took COVID to make doctors wash their hands." Um, the first time I saw a doctor wash hands was post-COVID. Infectious awareness of the pandemic, hopefully, is one silver lining. Um, there was a number of comments. Uh, um, Ricky, you have a giant fan club that I think is forming about your suffering, about what you've been through, and how amazing you are in terms of persevering and getting through that experience. Um, the um, uh, and there's one comment from Pam about how amazing you are, Teri, and in terms of reaching out to hospital staff, spreading the word. Knowledge is power, and your gentle, soft-voiced authority can move mountains. And I'm really very impressed with that particular interaction. Let me ask if there are other comments or reactions. Maryann, what uh, what do you suggest that we can do better to make the experience of C. diff less traumatic than it was for you?
I think from the beginning, I think it begins with this differential diagnosis. When you're not in the healthcare business, you're just a patient that's sick, and someone, you're exploding everywhere, and you know that something's horribly wrong. It would be of great benefit to have that acknowledged by the people that come to see you to give you a diagnosis. Often what happens is that they say it's not this, and then they turn around and leave. And we're left, and this is just like scratching the surface, but we're left in a bed swimming probably in diarrhea and tubes and loss of control, and you almost feel there's something wrong with you, like it's your fault because they have told you it's not this, we thought it was this, it's not this, and then they leave. They don't say we're going to get to the bottom of it. That's something that really would be helpful. Also, I'm sure everyone here, if they've been hospitalized, knows that you have one doctor that does one thing, another doctor does something else, another doctor does something else, and it feels like oftentimes there's a lack of coordination. And it's a brief moment in time that they see you, and then they're off. So that's a big part of it. Also, as I mentioned previously, just when you go home, the fact that this disease continues and that you can expect to have a recurrence is really important. There were a couple of times I was at home thinking I was supposed to be getting better, knowing that I wasn't, and I lost consciousness and fell and I cracked one side of my face. I was alone. So things like that should have been made, known that something like that could happen to me if I was not going to be eating or drinking for days on end. So, just having that kind of interaction with the patient, but also the family of the patient, super, super important. This is a long hauler. We hear all of these terms now with COVID. We're all uniquely qualified and prepared to deal with COVID in this group. We've all been isolated for long periods of time. We've all been infected with something that's infectious or communicable. We know what that's like. We know what it's like to not know what's happening, what's going to happen next. Many people are losing their jobs, their livelihoods. The world is turned upside down for the whole planet now. Well, that's what it was like for all of us with C. diff. So, yeah, those are the things that I'd like to focus on. I personally, if I could run into a hospital and sit at the bedside of someone with C. diff to help shepherd them through the process, that's what I would do.
Thank you, Maryann. Um, I think what you said about C. diff qualifies us to understand COVID is such a perceptive comment to make. And I think that the response to COVID, the fact that with COVID, there have been over 560,000 of us who have died in the United States, that there have been over 30 million of us that have developed COVID in the United States. Now it's the time to realize that all of us are vulnerable, that our health is connected with each other, that no one is safe until everyone is safe. And if we have a healthcare system that is so porous that we need a special friend or special luck to be able to get through, that this is the time to make it more secure, to make it more embracing, to make it more human. We're in the midst of, among many other things, a kind of a healthcare crisis in terms of physician burnout. There are over 400 physicians who commit suicide each year. And I'm working in my local medical school, and we really feel that listening to ourselves and generous listening to each other is such an important part because healthcare is human care and caring for human beings in the totality of what their experience, not just the pathophysiology of a positive test, but their humanity is not only good care for the patient, but this is a way to be a doctor and not to burn out from the issues of being overstretched, being busy, electronic medical record, fear uh, of litigation, et cetera, et cetera. This is the way to make healthcare human care. And I think COVID points this out. And Maryann, you have been seeing this for a long time prior to COVID. There's one other comment from Jose. Jose says that this is a very moving conversation and it's eye-opening on the difficulties in getting appropriate care. We are all vulnerable human beings. We are all doctors. We are all patients. Each of us are vulnerable to getting health issues, and we need to be aware that it's going to impact us in all kinds of ways and different types of, with all types of outcomes. Um, Carol, I was curious if you had any suggestions in terms of what we can do in terms of making this better and a safer healthcare system.
Well, I'd like to point out that it wasn't just my friend, but there's a volunteer physicians network in our state. And that was crucial for me because I did not have the money or the healthcare insurance to cover a colonoscopy and a GI specialist. So the fact that someone volunteered their time to do my FMT and the fact that the hospital volunteered the space, I wish that everyone hearing this in the medical profession would search inside their souls and find time to give volunteer time for procedures.
That's beautiful. I'm so glad that you had that resource available. Ricky, what suggestions do you have to make the healthcare system a little less trauma-inducing, safer, and better?
Sure. So, kind of bringing it back to post C. diff, I have friends that are in healthcare, and I've told them that I have C. diff, and they almost chuckle about it. They're like, "Oh, C. diff, we all know what that is as nurses. You had diarrhea," kind of like what they were saying when they diagnosed other people. It's just diarrhea, and they kind of laugh about it. And I'm like, "Oh, let me get on my soapbox again and explain to you." So this is me trying to explain to someone who works in healthcare, and they're always, "I'm so sorry." So I think just even that level of awareness of, yeah, I know in your textbook that it says it's diarrhea, but let me tell you about, what's not in your textbook. I think there needs to be more of that understanding and critical thinking, because like I said, my grandmother died and she had this. I can't imagine being, first of all, I can't imagine being 89. I'll be there one day, hopefully. But having to have C. diff in a hospital bed when you have bed sores and, you know, like Maryann was saying, tubes in your arms, you know, and you're pretty much swimming in your own, you know, toxicity. It's terrible. So I think to answer your question, Dr. Hirsch, is just maybe a little bit more empathy and a little bit more understanding of what C. diff actually is, and maybe hearing more stories of, you know, kind of like what we've been through.
I think you're right. Please, Teri, go ahead.
Oh, I just lost my train of thought. Helping, I think what Ricky just made me realize, we need to help people understand that diarrhea is not just diarrhea. There's a difference, and it just goes back to the education piece, like Ricky said.
Teri, when you say diarrhea is not just diarrhea, what else? What are you thinking?
Well, you know, when you have a gut bug, you might have 6 or 8 hours of diarrhea. But after 3 days of chronic diarrhea and you're not keeping anything down, it's not just a simple gut bug. It's not just diarrhea. Somebody needs to dig deeper. Somebody needs to look further. And kind of like our 3 patients have said, we need to not just tag it as diarrhea, take this and go home.
Right. My understanding of C. diff is that it is inflammation. It's a toxic colitis. The lining of the large bowel is inflamed, and the fluid is a response to that inflammation. And it's not just diarrhea, or a transient diarrheal illness from something that's benign. It is much bigger than that. And it's a systemic disease, not just one that causes diarrhea. And I think, Teri, you're absolutely right. Lauren says vigilance is a critical follow-up to education, staff, and patients' families, keeping each other in check when they see someone not following necessary contact precautions. Kiki says that this is such a touching and important discussion, and thank everyone for sharing. We're coming up towards the end of our time together, and I want to point out that it is the stories, it is the totality of people's experience that we need to communicate with each other. I think that C. diff is an example of being able to, we have to see people beyond just diarrhea, just a symptom. We need to see who they are. We need to see the person behind C. diff and understand the totality of experience. One of the things that's gratifying for me personally about being involved in the Peggy Lillis Foundation is that there's a story about a woman who died of a disease that their family did not know anything about. And here we are celebrating the life of Peggy Lillis, trying to understand what it means to go through a disease, to be vulnerable, to be open to each other, to be perceptive, to be kind to each other, and to advocate for a healthcare system that depends not just on good fortune and luck, but is vigorous and is able to support each of us. So I'm going to ask if there's any other final comments or final observations. Yes, Maryann.
Dr. Hirsch, I just want to thank you because just having the chance to get to know you through Peggy Lillis, boy, do I wish you had been my doctor. And I thank you for stepping outside of your daily responsibilities and speaking to us as human beings and genuinely concerned about your patients and for all of us in this common fight that we have. So thank you so much for your time. Next time I'm coming to you.
Thank you so much. And I want to thank everyone. I want to thank Maryann, Carol, Ricky, Teri for these open, vulnerable, sharing experiences. You've been through terrible clinical circumstance, And the fact that you have the strength to be able to reflect on it, to be able to share it, to put this in perspective, and to give it to us, we honor you for your stories. And all of us who are listening to these stories, thank you and wish you the best of health and the best of well-being. Let me turn this back to Christian, and thank you so much for listening and being part of this session today.
Thank you.
Thank you.